about the low air loss mattresses and the alternating pressure pad mattresses. So, in the previous video we made last week, we were talking about hospital beds and really the difference between both of them, the full electric hospital bed and the semi electric hospital bed. So, today, Tara is going to be talking about the differences between the low air loss mattress and the alternating pressure pad. Now, just to let you guys know, both of the mattresses are both air mattresses. So, these are mattresses that you will put on top of the mattress that you guys already have in your beds now. And they can go on any kind of bed, whether you are in a hospital bed or if you're in a home style bed as well. Now, the main purpose between the alternating pressure pads is to redistribute, air throughout the mattress to keep the blood flow. And today I'm going to be asking Tara specifically some main key questions about both of these systems, so that way we can have a better understanding. So the first question, why should a person get a alternating pressure pad or a
Well,
air
first,
loss
hello,
mattress?
hello everyone, and welcome to Tara. Let's talk with Silas and Tara. So, first of all, on the alternating pressure pad and the low air loss mattress, well, one, the alternating pressure pad, I would say, would be one that you would start off with. Reasoning for that is if, just an example, if you have a loved one who's in the bed for maybe 8 to 15 hours a day or more, and they have very limited movement, then you definitely want to look at having them get a alternating pressure pad. And so it will definitely help with the blood flow. It helps to prevent from wounds and ulcers and things of that nature. And so sometimes I know people will say, "Oh, well, what's the point? We're turning them every 2 hours." Well, that's not enough. So if you're turning your loved one every 2 hours, you still want to use an alternating pressure pad because it's going to help you in the long run. So the goal of the alternating pressure pad is to prevent you from having to go to what's called the low air loss mattress.
Okay, so that's really good. So, um, basically, the whole purpose is, like I said before, is to pretty much redistribute, the blood throughout the body. Because a lot of times with people in these, in this situation, a lot of times they're going to be in the bed for a long period of time.
Hmm.
So that is a very good system, because, if you're a person out there where you're in the bed, 15 to 20 hours out the day,
Hmm.
you're not, a lot of times the people are not really able to be as mobile in those situations, so that is good to know that there is a system out there that can pretty much help with that to kind of reduce the level of wounds occurring. So that's
Hmm.
really good. So I'm going to move on to the second question, and in the second question I'm going to say that who should use the alternating pressure pad. So obviously I kind of basically almost answered the question, already.
Yeah.
Like, pretty much this is for people who are going to be in a situation where they're going to be in the bed throughout the day. But can you just expound on that?
Yes. Well, too, also, it's more so with that when they actually, hold on a second. I don't know. I think I'm on mute. Oh, I think I was on mute the whole time. Oh my God. Okay, so basically, when it comes to the alternating pressure pad, if you have a loved one, again, I'll go back to the fact that they're not moving a lot, and also depending on their conditions as well. One of the things we always tell a family member is to look at the patient's back area and the buttock area as well, because sometimes, even though they may not have anything going on, if they're in the bed that long periods of time, or maybe anywhere from 8 to 15 hours a day like that, and there's not much movement, then you want to watch the skin of the breakage. You want to look at the redness of the, in the areas of in the areas in the back area and the buttock area, and even the heels as well, to see if there's any breakage there. And then I always, of course, we are not physicians, so we do not diagnose, but we do, to advise people to look at those things. And then if you have concerns, that you definitely want to speak to the doctor. And a lot of times I'll ask clients, do you have a wound nurse? And they're like, oh no. So I always tell them to reach out to your doctor, talk to the doctor, see if you can assign you a wound nurse that can come out or check the patient, or have that conversation with the doctor if you have any concerns. And then again, when it comes to the choices that you make sure you reach out to your local supplier to kind of make a choice, whether you in need of the low air loss mattress, whether it be the alternating pressure pad, the different options that's out there. because they have water mattresses out there, pressure reducing mattresses. There's a gel mattresses. There's all type of mattresses. So you definitely want to speak to a professional to kind of get an idea on what would be the best fit for you and your loved one.
Okay, so that's a really good answer. Pretty much you kind of covered everything with the alternating pressure pad.
Hmm.
And like I would say, this basically to simplify everything she just said, you guys, is that pretty much the whole purpose of the alternating pressure pad is to reduce the likelihood of wounds occurring. Now, of course, nothing's 100% because you do have to do other things like, you do want the person will still have to keep, moving inside of the bed. But the main purpose of the alternating pressure pad is the first step is to pretty much do preventative care. So the whole goal is to prevent it, is to pretty much tip the balances in your scales so that way you won't have to worry about these wounds occurring. Now, of course, nothing's 100%, but is the best precaution. So I'm going to
Uh-huh.
move on to the third question, and it pretty much dives deeper into the low air loss. So,
Uh-huh.
who is going to be the person that's going to be in the low air loss mattress? Because we do know that the alternating pressure pad is like the first step, the entry level, but that's pretty much for preventive care. But for people who may have wounds already, or they're already dealing with a wide variety of wounds already,
Hmm.
well, do they need the low air loss instead of the alternating pressure pad?
Well, it goes back again to that discussion you would have with your doctor or the wound nurse, because a lot of times when it comes to an alternative pressure pad, it's to help to treat and prevent, right? And so when patient has limited movement, when it comes to the low air loss mattresses, one of the things that you want to try to also talk about is because it can help the patient stay at home. You want to, if you can have your loved one at home, that's definitely what you want to do. Some the low air losses has for patients who have lack of oxygen. Wounds can also lead to sepsis. So you definitely want to make sure that when you are when you have your loved one, you just want to make sure that you have them. That you talk. I would say talk to the doctor first and talk to the wound nurse. Just to see what would be the best option for you. And again, if they make a recommendation and you're kind of confused as to which one that you would choose, whether it be the gel mattress, the overlay mattress, the low airline mattress, things of that nature, that's where you would reach out to your provider, a professional provider. And you're local. Don't just go online and just order something. Please speak to your local supplier.
Okay, so that's a really good answer as well. And pretty much like you said, the whole for the low air loss mattress, that's pretty much for a person who's pretty much already progressed in that wound stage.
Hmm.
So the goal for the low air loss mattress, to pretty much simplify everything you said, is that is to kind of help reverse the state of the wounds. Now, of course, the wound nurse will still have to be involved. There's still have to be a number of things that will still have to be done, but the
Hmm.
low air loss will pretty much help. When that, like when the wound nurse is not there and when not present, the low air loss is still providing that therapy to reverse the state
Hmm.
of the wound. Is that correct?
Yes, it is. And then one of the things too, I always tell people too, because a lot of times with the alternating pressure pad, we've had patients who it's made them even sleep better, because of the pressure, and things of that nature. And so I would definitely say to you know when you have your loved one, then you want to ask them questions about how they're feeling, if they have any tenderness going on and things of that nature. So I would definitely yeah, just again, I go back again to the doctor and to the wound nurse.
Okay, so that's that's really good. And the fifth question, which was pretty much the last question,
Mhm,
are these are both of these systems affordable? Because one thing we know is that in the DME world, a lot of these items they provide a lot of great therapy, but
mhm,
the only downside is that some of these items are really expensive, especially out the gate. I do know the low air loss mattresses do start at like around 1,000. They start at $1,000 and they just pretty much increase from there.
mhm,
But are some of these systems covered by the insurance, or is this a thing where okay, well, the insurance will only cover a certain kind? If a
mhm,
person wants, let's just say, okay, they want, um, they just don't want the basic. They just don't want a basic alternating pressure pad or a low air loss system. They want something that's going to be effective and that's going to be high quality, so that way it'll help. Will the insurance cover those higher end models or systems, or is this just a thing where the insurance is kind of like they don't really cover it that much, and you pretty much have to go through a lot to get them to cover it.
Okay. Well, when it comes to anything, when it comes to the insurance covering, it's always medical necessity. That's definitely have to be established there. But sometimes I know some patients where the alternator and pressure pad, because the patient might not have or show any signs of wounds at the moment in time, I still tell families and recommend it to families to prevent, right? And so in that case, it wouldn't be covered. But depending on what's going on with the patient, then there is a possibility that it, of course, yeah, it could be covered. The low air loss would could be covered, a gel overlay, different things like that. Again, it goes back to the medical necessity of it and what's going on with the patient and their diagnosis to determine if it's going to be a covered item or not. But when it comes to the alternating pressure pads, they're under $200. Like literally, I always tell people, like literally, save your love. I mean, wounds are very painful. We've had patients where they started out with a small wound and then it grew to a point where you can actually put your fist inside. They're very painful. And so the whole thing is you want your loved one to be comfortable. You want them to not be in pain. And so with that, you want to get things that's going to help those, that type of situation. The whole thing is to have them comfortable and living a comfortable life, So that's what the goal is. And so, but they are the lower air loss mattress is expensive. However, it is covered through the insurance based on medical necessity. And so, of course, sometimes depending on what insurance you have, if it's not covered, you can definitely talk to your local supplier and see if you can work a deal out. They have things out there, financing where you can make monthly payments and things of that nature. So definitely look into those options as well.
All right, so that pretty much covers everything with the topic today. Um, I want to kind of get back into the government side of things because I know in our last video that we made, we pretty much we kind of dived into the government side of things.
Hmm.
Once again, like I said, if you are a person out there where you're trying to get into the government space,
Hmm.
it's very easy. Well, I won't say very easy, but like once you get past the paperwork side,
Hmm.
you can pretty much start bidding right away. And I would say is that there are literally different lanes that you can take in the government space, in the government contractor space.
Hmm.
You can be a provider of products. So like for us, like with CFS Medical Supplies and Equipment or CFS Solutions, we pretty much do like we provide products, medical products, and other kind of expensive products like cell phones, iPads, different things like that. Because like I said before in the last video, the government pretty much asks for everything. They pretty much will purchase anything. They ask for the dirt on the ground. They'll ask for bottles of water in large amounts. So there is literally this like there is no limitation when it comes to the government contracting space. And like I said, if you guys are if you're an entrepreneur out there, trying to figure out like how can you scale your company, I would highly encourage you to really dive into the government contracting space because it's very lucrative once you get started. Now, of course, I there were some people that I talked to before since our last video, and they kind of talked about some of the barriers that they encounter. Like for instance, in the product side, a lot of times they find that okay, the agency is asking for this particular product and it'll say like a brand name only. Now, this is a huge thing because a lot of times with the government contracting space, a lot of these bigger companies they have their own department that goes after contracts themselves. And a lot of times, if you're calling about a particular product, they'll say like, "Oh, we only sell to the end user," or "We already have our distributors already." So the way to get around that is to go after contracts where it says brand name or equal. And if you go after brand name or equal, that means that they're asking for that particular branded product, but they'll accept another brand if it's a similar product, pretty much. So let's just say a car. If they're asking for a Toyota, or let's just say something even better. Let's say a dirt bike, for example. A dirt bike, pretty much dirt bikes are made by a lot of different companies and manufacturers, and they're pretty much all the same. They all have the same kind of, horsepower, the mechanics, and all that, but they
Hmm.
just have a different name on it of who makes it, right? So if the government agency comes out with a contract saying, okay, we want a dirt bike that's made by the Yamaha, for example, and they're saying, okay, what's brand name equal? So that means that, if the salient characteristics, and that's pretty much just the characteristics describing the product, if that's similar on another brand, then they'll take that as well. But one thing that's very important about the government contracting space is that they're always looking for the lowest price. And this is something that also a lot of people I've talked to in this space have talked about, is that not only sometimes you have to get the particular product and it can be difficult, but also you want to get the best price possible. And the way you can do that is by one, lowering your price margin. I know a lot of times the whole mindset going into government contracting is like, okay, well, that means I can just, charge any kind of price. But a lot of times they'll say in the contracts is that they'll say lowest price acceptable. So pretty much they're asking for is the lowest price. And the
Exactly.
interesting thing is that even in contracts where they're saying brand name equal and they ask for that Yamaha particular item that's made by Yamaha, so let's say the dirt bike that's made by Yamaha, and you have another brand saying, okay, well, they're charging a lesser price, they'll go after the lesser price over that preferred product. So that there's just some things I just want to point out in the product side. And then also, Tara, do you know anything about this staffing side of the government contracting world?
Yes, the staffing side of it. So basically, when it comes to the staffing part of the for some reason, I feel like I am literally on mute. I don't know why, but so when it comes to the staffing is where we just actually started to get into the staffing part of it, where they look for nurses, anything dealing with healthcare, and the healthcare side of it is where we are. We have some things we're looking at when it comes to IT, and so yeah, but again, it goes back to the fact that they pretty much contract for everything. So even if you see people out and in your area working on construction, 9 times out of 10, it's a contractor, somebody providing a service for the government. So I would definitely say it's something you should look into if you are a small business and you're trying to scale, and then also, if you don't have a business, but you're looking to get into entrepreneurship, and it's a great option for you. And so, again, we'll go back to the fact that if you're ever in need and you want to, we offer services that we help people as a consultant when it comes to, of course, medical products, and then definitely for the government contract as well. And you can check us out at cfsmedicalequipment.com, and we have different tabs on there. You can actually go to our government tab and see what we've done in our past performances and things of that nature. You can also look and see the app we have on there where you can download to help you figure out some of the maze of the healthcare resource arena as well. And so just information on there, just trying to help people out. So again, cfsmedicalequipment.com. And with that, we will wrap up today, and we'll try to jump back on here and give you guys some more information on some questions that we get asked. So we try to bring them here to the forefront of questions we've been asked. So, Silas, anything else today?
No, there's nothing else. We pretty much covered everything that we wanted to talk about today. We talked about the topic on the medical side, the DME side, which is the low air loss mattresses and the alternating pressure pads. And we also were able to kind of dive a little bit into the government side as well, talking about like what Tara just talked about, which was the staffing, and also me talking about the product side. Like I said, going back to the government, it's a wide. It's the sky is literally the limit. So I really encourage you guys, if you guys are an entrepreneur or you have a company you're trying to scale, get into government contracting. All you have to do is go to sam.gov, register your company under sam.gov, and literally just start bidding. The more times that you submit bids, the more likely you're going to win multiple contracts. And then also going back to the DME side, which is CFS Medical Supplies Equipment, you can visit our website, and we pretty much have different information about how to use these products. And also, if you have any questions, feel free to call us. Our phone number is 310-817 5373. So I'll say the number again is 310-817 5373. And yeah, have a good day.
All right. Have a good day and a good weekend. Bye bye.